Good afternoon, everyone. It's a bit stressy to start off the program, but I will do my best. I would like to introduce you to some early life programming on obesity. As Professor Lizzie said, this was a big part of my PhD research. And the problem is, you are all aware that we are facing a pandemic of obesity, children with obesity, adults with obesity, and also our more smaller children, toddlers and preschoolers with obesity. The start of this problem is during pregnancy. However, that's not exactly true, but I will come back on that. During pregnancy, a lot of processes are being formed, and also our fetus is developed, and also all the hormonal axis will be programmed for the rest of the life. And we are now overwhelmed with a pandemic of children who are obese or have overweight. And we see that there is a shift in the age group. So we see that there are more preschoolers and more toddlers that present with severe forms of obesity. This is also the reason why the WHO stated that childhood obesity is one of the most serious public health challenges of this century, because the prevalence is increasing at an alarming rate. And for the moment, as I may say for all of us, we are not really tackling it. We are all trying our best, but I think the problem is that we are facing a vicious circle, not only starting during pregnancy, but already before. Actually, the start for the programming is preconceptional, and for that I want to take you back to the history, because the Dutch famine winter was the last winter of the Second World War, and there was a part of the Netherlands where there was a lot of famine, and actually because all of the food was really well registered during that time, because there wasn't nothing. They followed actually all the pregnant women during that time, and they made a cohort of the offspring of these mothers. They followed them for now more than 60 years. All these children were born with a smaller birth weight. So first idea was, okay, so they will have less obesity. But this is not true. They saw that these, especially the men, I'm sorry, it's so, they presented with an increased prevalence of metabolic syndrome, obesity, and they died earlier of cardiovascular complications. So this means that there is a vicious circle linking maternal and childhood obesity. The researches done during the famine winter in the Netherlands gave actually birth to the Baker hypothesis, where there was really a link between obesity or overweight during pregnancy and the development of obesity during childhood. As you can see, this is a figure from America. You can see that 2 in 3 pregnant women are overweight or have obesity. And we see in these pregnancies that there is a different placental nutrient delivery. There are also epigenetic alterations. There is chronic inflammation and also a microbiotal change, which means that the fetus is already programmed in a different way. And as we see, as we look at the prevalence of maternal and childhood obesity here in Belgium, you can see that the prevalence has increased over the last years and follows a similar trend. So it's a vicious circle, and despite our efforts, we see that this vicious circle of obesity affects mostly families with a lower socioeconomical status, which makes it difficult to break the circle because there are lower rates of breastfeeding afterwards. They use more unhealthy food afterwards. Their chances for education are also lower, so they will end up also with a job earning less money, making it difficult to break this circle. We also know, as you can see in this cycle, that when we start with having obesity at a childhood age, about 2/3 of these children will continue to have obesity at an adult age. So it's really important to take into account the beginning of the life, because the first 1,000 days, which means from the conception until the age of 2, was also stated by UNICEF that what you do and eat in these first 1,000 days makes a difference for the rest of your life. So it's the most important period where we can invest. The early adiposity rebound is also a concept that I would highlight, because we know that the children or adults having the most severe forms of obesity at an adult age already started gaining weight earlier in life. So I think this is also a risk factor, and these are also children that we should try to identify earlier. Normally there is, as you can see, a dip in the BMI around the age between 4 and 6, but the earlier you start to rise with the BMI, the higher the chances to have obesity at the childhood, as an adult. We are all pediatricians, pediatric endocrinologists, generalists, I don't know, whoever is listening. So we are following children through the whole lifespan. And I think it is really important that we keep in mind every time we see a child, is there a reason why this child has an increased risk of developing obesity? The most critical periods are from, as I already said, the first 1,000 days is from conception until the age of 2, where we can invest in maternal characteristics and also try to control the rapid postnatal growth. Then when we identify an early adiposity rebound, we should monitor the child. And then the third critical period is the weight gain during adolescence, which is really hard to tackle. It's not that easy. As you can see, there is a lot of different factors joining in. I highlighted some of the early programming mechanisms, but it makes it is so complicated that our brain is programmed differently. There are other food cues. There is a different attitude towards physical activity. So I think we should really see these families as a whole, but I think my colleagues will elaborate on that, because they have a lot of risk factors to stay in this vicious circle. And as you all know, we live in a world right now that makes it really difficult to make healthy food choices. You can see that everywhere you look, there are unhealthy foods. They are most of the time cheaper than the than the food that we want our patients to eat. And we also know that some children, some adults are more susceptible to react on these food cues that are seen in the environment. So we still have a lot of work to do. There is a lot I think we still don't understand, but it remains, I think, our duty and our priority to make sure that we follow these children from early on. And actually we would like to have the gynecologist involved as well, to have then followed already during pregnancy, to really make a change and to really change the vicious circle of programming of obesity. Thank you.